Hi, my name is Dr. Charlene Irvin Babock, and I'm a practicing emergency medicine physician in Detroit. And on this video, I'm going to show you how you can potentially use a Bi-pap machine as a ventilator. Because of the COVID-19 pandemic, many clinicians may find themselves in a situation where they have more patients who they need to ventilate and they don't have enough ventilators. And so that's why I think this information may be helpful for you. Now, a few days ago, I did a video that talked about the dire circumstance where you may need to use one ventilator for more than one patient. And in the comments section there, people wanted to see this up close. So I'm going to show it to you up close. You would need two of these circuits, one for the inspiratory circuit and one for the expiratory circuit. It has 4 T-tubes and it has 3 22mm adapters. And for the inspiratory cycle or the expiratory cycle, you simply add the patient to the port. Obviously, if you're going to use this in the patient situation, you would rotate at 90 degrees so that the ventilator port is going directly towards you, and then these 4 ports are for the patients. Now, there was some question about the cross-contamination infection risk, which is real. And remember, this is coming from the ET tube of the patient, if this is the expiration port, and that's about 5 feet of tubing. But when it gets to this point, right before it goes into the ventilator, is the area where the gases can mix. So if you put a filter before the expiration port, that might mitigate that cross-contamination infection risk. Now, other people said they had a hard time finding the original article that I was referencing. This is the original article I was referencing. It was with my co-author, Dr. Greg Niemann, who was a PI, and it was published in 2006. I also found another article that was published in 2008 in Resuscitation, where they used something similar, parallel 4-circuit with one ventilator to ventilate human adult-sized sheep successfully for 12 hours. It's difficult to extrapolate in this situation because those are normal lungs. Finally, some people were asking about the possibility for using 3D printing, and this is an article that was published also by Dr. Greg Niemann, who shows that he actually already did it, and it's published, and he's got the information in here about how to 3D print a device such as this. Now, on to using the Bi-pap machine as a ventilator. You can see here there's a V60, and this is key, because if you have the V60, it means that this Bi-pap machine can be used as a ventilator. It turns out that these machines with V60 are actually licensed to be invasive ventilators, and but that's only in spontaneously breathing patients. It's off-label if you use it in a paralyzed patient. So the tubing you use is the same tubing that you would use for Bi-pap, just one tube, and on the end of it, you have to stick the device that you would normally use hooked up to your ventilator. So this is our tubing we have here that we use for patients who are intubated. Here's our ET tube. Here's a 2-way infection valve that filters viruses and bacteria. And so I'm just going to take it off the ET tubing, and I'm going to put this end on the end of the tubing that we are going to be using, which is our Bi-pap tubing. Now I'm going to take off the ET tube because instead of the ET tube, I have a test lung. This test lung is very stiff, so it will mimic ARDS. So this is my whole setup that I'm going to use when I use this Bi-pap machine as a ventilator. Now, normally in a regular endotracheal tube with a ventilator, you have 2 ports, one for the inspiratory pipe and one for the expiratory tubing. Inspiratory tubing and expiratory tubing. This only has 1 tube, so the expiration has to come through a little hole right here on the side. I'm going to come up close so you can see it. It's right there, and that's the expiration tube. Now, some of the tubing also comes with this little rubber stopper that can sometimes be used to put in place of that tubing and block it. Now, I would suggest that you cut this off so a nurse or somebody doesn't come along and say, oh, there's an air leak here, and put this in the port and block the port. That is the only expiration site for the patient. So cut that off. I left it on so I could show you, but that's the only expiration port. So this is the whole setup of the tubing. I'm going to leave the test lung right there so you can see it working. Now the machine. Again, you're lucky if it's a V60. That means it can be used in ventilation. I'm going to turn it on. And the first thing you're going to see, it's going to be in the mode for Bi-pap, which is what we usually use it for. It's 12/5. That's a typical Bi-pap setting. So the first thing you need to do is to go into mode. You need to tell the machine that you're not going to use it as Bi-pap. You want to use it as a ventilator. There's several different settings you can use as a ventilator in these machines. I'm going to show you one. I'd encourage you to contact your representative for the machine you're using, and they can go over all the different parameters and how to do it. So the setting I'm going to use is something called AVAPS. That stands for Average Volume Assured Pressure Support. And that's just one way to do the ventilator. Now you have to activate it for it to work, so now it's activated. And these are the settings they're currently using. You also have to go into menu though, and you have to tell the machine that you're using an ET tube. You're going to have to go into mask and ports. You have to tell the machine what the mask is. And the mask is not really a mask. It's going to be the ET tube, which is one of these options right here. So I'm going to cursor over to it, and now it's there, and it says it right there, and I'm going to accept. Then I have to tell the machine what kind of tubing is coming back to the machine. In this case, it's the disposable exhalation port, which is what your typical Bi-pap tubing is. So that's correct, so I'm going to hit accept. So now it's working. I'm going to put this back into its non-compliant mode, so it's ARDS. And you can see here, we're not quite at the peak of 500. And that's because it uses a rolling average in the pressure. So the minimum pressure is 15. If I take that minimum pressure and go right up to 25, then accept, the next breath will be at 500. And that's because with the rolling average, the machine will slowly get up to 500, but it may take too long, and you don't want it to take too long. So now you can see here, I've got this is 1,000 milliliters at the top. I'll take it like that. You can see it's 550. It's getting adequate volumes. Peak pressures are 24, all fine. And this is in a ARDS type test lung that technically is in a paralyzed mode because it's not breathing on its own. Now, one thing you have to be careful of, you have to be careful of interpreting these numbers up here. These numbers are the average over the last 6 breaths. It's much better to look here to make sure you're getting adequate tidal volumes. So that's how you can modify one way a Bi-pap machine into a machine that can provide ventilation. Now, you might say, well, what are you going to use this for? Well, in a paralyzed patient, remember, it's off-label. It is not off-label in a spontaneously breathing patient. But one of the comments from the previous video was, how do you wean them? Because all of the patients are on the same cycle and they're all paralyzed, because they have to be paralyzed if you use it in the dire circumstances where you might use it and have 4 people on one ventilator at the same time. Well, this actually may offer a way to get around that, because if the patient is paralyzed and you transition them to this type of setting, you can allow them to wake up from the paralysis, reverse the paralysis, or allow the sedation to wear off, and then they can start spontaneously breathing. In this particular setting, AVAPS or AVAS, the number of breaths you give them, which I put here at 16, is guaranteed. If they can breathe more, and they will get pressure support for breathing more, but they will have a minimum of 16 if they're not breathing. So hopefully this information is helpful for you. A lot of people don't realize that a V60 Bi-pap machine can be used as a ventilator. I hope you find this information helpful. I'd like to thank all the people that helped me doing this video, including Nino Papali, Nick Sternicki, Eunice Sharif, Linda Taggart, Leah Reamer, and Brenda Bartos. Thanks so much, and good luck to you. Have a great day.